ventilation in order to cause the patient's death, an act of omission. Okay? Everybody hear the confiteor from what I have done and what I have failed to do? Commission, omission. Voluntary, patient gives his consent. I want you to do this to me. Non-voluntary, infants, okay, that have, quote, no quality of life in the Netherlands. And they are unable to give their consent. Somebody else gives consent for them. Involuntary, think execution. Okay. So there are a variety of places on the globe right now that have euthanasia or assisted suicide. We're going to be talking about them. This is an older map, but you can see it's running down the Pacific Spine. Most of Europe is involved, most of Australia is involved, New Zealand is involved. I know places I don't want to be visiting when I'm getting older. I really want to go to these places. Here's the United States right now. This map came from the Charlotte Lozier Institute, and this is as up to date as we can get. As you can see, there are 10 states, and the District of Columbia sneaks in there too. Gee, the left coast, what a surprise. Colorado, New Mexico, Hawaii, Maine, Vermont, New Jersey, Washington, D.C., Delaware's not there yet. And then there are a variety of other colors on here. Montana may have it by government fiat, by a judge saying, yeah, we should do that. So there are a variety of places. And the interesting thing is, in these states, if somebody dies by assisted suicide in Washington and Oregon, you're not allowed to put that on the death certificate. You have to put natural causes. You're not even allowed to state what they actually died of. That's how frightened they are of actually hearing the truth. Okay? These are laws. If you put that on, the state functionary who's in charge of death certificates will not accept it. So you can't even list the true cause of death. So what is the rationale behind medicalized killing? Fear. Fear is there. But radicalized autonomy. Autonomy, as I mentioned earlier, is very important to all of us. We want to make our own decisions. But radicalized autonomy, nobody is the boss of me. I get to do whatever I want. Nobody has any claims on me whatsoever. This is part of the degradation of our society today. This and radicalized egalitarianism, everybody gets the same outcome, has been a real problem. But autonomy is good, but radicalized, putting that as your only judge, okay, above anything else that you want to talk about, anything else you want to use, any other ethical evaluations, whether you want to look at non-maleficence, beneficence, justice, all these other things. If autonomy is do-all and end-all, we're going to run into trouble. Fear of suffering. And it's interesting, it's not fear of pain, it is fear of suffering. Fear of being a burden, again, loss of autonomy, cost of ongoing treatment of care, an economic concern. These are valid concerns, but we have to have better ways of addressing them than killing the patient. So this is a survey that was taken by recipients of medical assistance in dying. I think this is from Oregon. And this tracks again and again and again, whenever places that have euthanasia-assisted suicide, when these questions are asked, it usually tracks along this. Look at where pain control comes in. About 50%, a little bit over 50%. What's the number one? Loss of ability to engage in meaningful life activities. 80%, 8 out of 10 people fear their inability to continue to do what they wanted to do. Loss of ability to engage activities of daily living. Inadequate control of symptoms other than pain. So these are the biggies. Okay, loss of bodily functions, isolation, loneliness, they're all on there, but they really rank very, very lowly. So it's lack of autonomy and lack of ability to care for oneself. We have to do a better job. Okay, that's a graphic representation showing you exactly the same thing. The statistics, Netherlands in 2020, almost 7,000 patients out of 169,000 deaths with a population of 16 million. California's population is, what, 35 million right now? Just to give you an idea that the Netherlands is maybe half the size of California, and about 5% of their patients are dying of euthanasia and assisted suicide, 10% rise every year. 2022, the last year that we have statistics, almost 9,000 patients dying at the physician's hand. And not all of these are voluntary. Not all of them are adults. Okay, there are infants that are being euthanized. Okay, because of no quality of life. Okay, trisomy 15, trisomy 18. Talk to somebody with Downs, if you can find any with trisomy 21. They have a good quality of life. They enjoy life. They're wonderful people. Okay, some have intellect of high school students or greater. Even the ones that do not are delightful human beings. They're like 5, 6-year-olds. You can interact with them. They have big grins on their faces. They're clearly enjoying life. In Iceland, they have cured Downs, they say. You know how? They do prenatal testing and they abort anybody with Downs. Okay, that's how they've cured it. And they've cured it. Okay, Canada, 2021, 2022. In Canada, they passed this act in 2016. By 2020, there were 7,500 cases out of 300,000 deaths, 2.5% of deaths, increase of 34% over 2019. By 2022, 13,000, an increase of 30% or more. Total deaths from May to counting from 2016, almost 45,000. That's in a population of about 30 million, smaller than California. But they are losing 4 or 5% of their population every year, and many of these they're mostly pretty much all voluntary, but not all of them are even terminal anymore. It's horrible. So this is the Netherlands. You can see when it started in 2003, it's been ascending dramatically, and this is per 100,000 population. Again, every year going up and up and up. And this slide is particularly interesting. They used to say, oh yes, we're doing a very rigorous review of the medical records. When they started in 2002, it took just about an hour to review medical records. Medical professionals here, you've seen medical records. Can you review a medical record in an hour? No. Okay? And these are life or death situations. In 2008, they stopped measuring hours. They went to minutes. That's this orange line, and here's the minute scale over here. 50, 40, 30. By 2016, less than 20 minutes were being spent on medical record review before they said, yeah, you qualify. It's some games, okay? And it tells you really where these people are. Okay, Netherlands is horrible. Canada, on the other hand, I think they felt that they had to catch up with the Netherlands, and they did. In 2015 and 2016, there were court cases that said, you know, those provisions saying physicians aren't allowed to kill people, we're going to throw that out. The medical assistance in dying law was passed the next year, and then in 2019, reasonable foreseeability of natural death eligibility criteria has been dropped. And so as of St. Patrick's Day of this year, you can kill yourself in Canada for almost any reason whatsoever. You don't need to be terminal. You don't even need to have any chronic or severe illnesses. If you're tired of living, there are people who wanted to kill themselves because they were going to be losing the rent-subsidized employment. They didn't have any components. Or somebody was severely depressed. Or they had a sex change operation that didn't go well. It was very painful. Or they had severe schizophrenia and they were tired of it. Somebody lost his girlfriend and was diabetic and losing his eyesight, and he didn't want to live with this. And you know, the list goes on and on and on. It's insane. And again, the number of cases in Canada follows that same hyperbolic curve, 13,000 as of 2022. And the little red line here, natural death is not reasonably foreseeable. This is going to balloon in the years to come because all of the safeguards, all of the safety rails are now taken down. Okay? All of these things that I'm going to show you, for terminal patients, you had to have unbearable suffering, certification by 2 health professionals, all out the window. All of these other criteria, 18 or over, they're still holding to that decision-making capacity, They're allowing demented patients who really don't have it to be able to say it, and then they're acting on it. They don't ask for psychologists, psychiatrists to assist, intolerable physical, psychological suffering. No, all of these have been brewed. All of these criteria that they put in with all of the great fanfare, oh, we're going to take care of these people, we're going to protect them, all gone. Okay? As of St. Patrick's Day, what a way to honor St. Patrick. But there are more euthanasia-assisted suicide in Canada per capita than any other country. 27 people a day died in 2021. Twice the unassisted suicide rate. Why try on your own? Have a professional do it for you. And 4% of requests were rejected as of 2021. Now that number is going to be 0. Simply because the criteria have all been removed. You can do this for any reason whatsoever. Why shouldn't we be doing this? Easily stated. I got into medicine not to kill people. Okay? And nurses, in particular, got into nursing so that they could help people, not kill people. It can, if you go in and you see your doctor and you don't know whether they're going in, he's going to, slip you a Mickey the first chance he gets, you're not going to want to see that person. You're not going to trust him. And also, in many of these states, you don't have that out. Remember the Little Sisters of the Poor with Obamacare? Okay, it was some nuns who had some help, had some employees. They didn't want to pay for abortion drugs. They didn't want to pay for contraceptives. Obamacare said, you must do it. They took them to the Supreme Court twice, maybe only once. But Obama's administration took the little, not even the big sisters of the poor, the little sisters, and not even the little sisters of the rich, little sisters of the poor, and they got dragged into court and probably spent millions of dollars. Okay, I stole that from Charles Pratt. He was a brilliant guy. But you don't have conscience provisions any longer in many of these states. You have to leave the state to give up your medical license. Rationale ignores facts, obfuscates facts. Inadequate pain control. We can control pain. We have tons of things we can do. Hospice care has been tremendous. Unable to control suffering. This is where we need to work better. This is where hospice care, palliative care, social services, and spiritual guidance all have to be in this. Caring for the family is important. Lack of patient resources. These all add into the perceived need for this. We have to fix this. We have to work more on it. Plays on the fears of the dying, ulterior motives, cost of caring for the chronically ill and dying. And again, Canadian Health Service, British National Health Service, many times now, patients are going into Canada and saying, I have these medical issues. The first thing they talk about is medically assisted suicide. They don't even talk about treatments. They talk about, well, this would work really, really well for you. It's incredible. British National Health Service, of course, everything is paid for by the state. Every patient is a cost center. Okay? It'll cost you $100,000 to treat the diabetes for a year. It'll cost you, $2 for barbiturates. It's pretty clear what direction the bean counters are going to go in. U.S. insurers are not too far behind. And this whole thing of misuse of scarce resources. In Canada, that's a little bit more binding than here, but that's still a major concern. So these are the major arguments against euthanasia-assisted suicide. Human dignity. We are of just immense worth. Okay, every human being, no matter what their state in life, is worth more than any other animal on the earth at any time. We all have to recognize this from the moment of conception until the moment that we die. Okay? We have a lot of believers here. And this is true no matter whether you are a Christian, non-Christian, agnostic, atheist, it doesn't matter. We all have this human dignity that never goes away no matter what our state is. And we have to be treated as dignified human beings. Medical profession. If we become killers, who would ever trust us again? I certainly. commitment to palliative and hospice care. Boy, this is an area that really needs to grow. I've been working with hospice care people and with palliative care people, some of the best people in the world. Since Dame Cicely Saunders started the hospice movement in the 60s, I believe, in Great Britain, and came over to the United States. It's just been a tremendous boon for the chronically ill and the dying. I can't say enough for this, but it needs to be expanded. It needs to be made even more available. Protection of the sick and the aged. We all have to do a better job of this. We have to recognize those people who need assistance and get them to them. And the last is the slippery slope argument. Once we start with, say, saying, oh, this poor person is suffering so much, before you knew it, you got a 28-year-old who breaks a nail and wants to end their lives. And say, okay, yeah, let's do it. Okay, that's the slippery slope. We start at a very high plane, and then your moral underpinning is eroded bit by bit by bit, until before you know it, you're ready to euthanize anybody or give them whatever they want. And what is the present euthanasia capital of the world? Probably Ottawa right now. And there is such a thing called euthanasia tourism. I heard of twin sisters who flew to Switzerland, not telling their family, nothing much wrong with it. They weren't even chronically ill. I think they were both just depressed. They had themselves killed in Switzerland. The family only found out later. Okay, Oregon and Vermont have been vying as the United States seat of tourism. Canada has overtaken them all. You don't even have residency requirements. Vermont and Oregon have been fighting it out. There used to be residency requirements. You have to live for 30 days, 90 days in the state. They're getting rid of those. Canada has already done it. This is just a beautiful planetary nebula. But, okay. Pain control principle of double effect, suffering control, hospice care, social services, care for the family. So vital, so important. I know that there are hospice workers that have been around. At St. Vincent, I've had the great joy of working with these people for the entire time I was there. And they've just been tremendous. A good social worker is worth the wait in gold. Care for the family. The family must not be neglected in this either. They are so important. They have to be supported the whole time. And where do we need to go from here? We need to educate ourselves. You guys are doing a great job. You're here. Okay? You're being alerted to this. You want to learn more. These are some of the ways we do it. We've got to educate our medical community better. We need better social services always and forever. We need better palliative care. We need better hospice care. End of life is hospice. Palliative is anybody else who has a chronic illness. We need to be able to help them at any time. And last but certainly not least, political action. Every year in Pennsylvania, somebody brings up a, quote, death with dignity act, okay? They love euphemisms. They don't want to say, we're going to put you out of our misery. We're going to say, we're going to give you medical assistance in dying. Oh, that sounds so wonderful. Death with dignity. I don't see anything dignified about killing somebody. I don't see anything dignified about assisting somebody to kill themselves when there are so many positive options to allow yourself the time that you need. So there are so many things that we need to do. This is just the start. So, Cat's Eye Nebula, another beautiful thing. So, always up, every night you can see this. And if you want to get those references that I have on a hyperlinked thing, here's my email address. Just send me an email. I'll be happy to send that to you. The National Catholic Bioethics Center is a great beginning resource. The Catherine Lozier, or the Lozier Center is excellent. Those are all on the lists, but I've got a number of things specifically talking about assisted suicide and medicalized killing, death by doctor, on those references. I'll be happy to send it to anybody who wants. And if you have any questions, I'll try to answer them. I know I've been droning on here for darn near an hour, but I think that this is so vitally important. And I thank you all for coming out. Really, it's been a tremendous opportunity for me to be able to talk about this with all of you.
John, if I could ask a question. You know, you you've really laid out such a beautiful case, and I understand it so well, but what or who are the driving forces behind this movement? Because it's not obviously just a U.S. thing. I mean, it's a multinational movement. So what's behind it?
You know, there are so many different problems that are, it's what is degrading our society today, okay? It's this all-pervasive belief that we are our own actors, okay? It goes back to original sin, if you want to put it that way, okay? We have the ability to say what is good and what is evil, okay? We are like gods, okay? Once you buy that, that was moral relativism is a really big aspect of this. I get to say for me what is right, and nobody else has the right to countermand it. So that's a very big aspect of this. Believing that you have the ability to, speak over God, over man, over customs, over anything else, and just push that on. And then there's a number of other very nefarious things that are going on. There are a number of people, frankly, I think they really enjoy. There's euthanasia. There's not just a euthanasia movement, but a eugenics movement. Okay, we want to get rid of the people that are just consuming our scarce resources. Okay, I've alluded to that before. That was really big in the 30s. Margaret Sanger was a big eugenicist, and you know what she started. And there's a variety of other places, a lot of other philosophical movements that believe that we're over-consuming. So we have to reduce the amount of consumption. In national health care services like they have in Canada and in Britain, they have a finite amount of money that is spent every year. And if that gets consumed by people with chronic illnesses, it may not be available for your illness. So you end up at the end of the year not being able to get the care that you need because somebody else is consuming it for you. So that's a flaw in the healthcare system there, but those are some of the reasons I think that's going on.
So if I can ask one quick follow-up. So are the big drivers, for example, insurance companies that would have a stake in the use of resources, and then also, what about like the World Economic Forum? Are they a driver as well?
Yeah, there you go. I'm afraid that you've hit on a big one. Klaus Schwab and all of those people, they want to control every aspect of your life. Okay? They don't want you driving. They don't want you traveling. They don't want you eating the food that you want to eat. Meanwhile, they're going to get in the private jets and go all over the world.
Yep.
Okay, so there's an awful lot of these people who are absolutely determined that they know better than you do how to live your life, so that you are not in their way, in their plans. There's still a very strong that the Club for Rome in the 1960s talked about humanity being a disease on the planet Earth, and that we should only have maybe 500 million people on the planet, because otherwise we're harming Gaia, all right? Which is such pernicious nonsense. To hate humanity so much to say that we should kill off 85% of the population in order the Earth doesn't care one bit about us one way or the other. I mean, I love being on the Earth, but I don't think it cares for me. And wanting to kill 5 out of 6 people in order to make sure that the planet does better is absurd. A lot of people believe that.
I was going to point out, there's your slippery slope ever since the 60s.
Sure.
Once you can kill the youngest, you can kill the oldest. I mean, if you're not mentally competent enough to return from the womb, then there you are in memory care, secondary resources. So it's definitely the slippery slope. I was just going to point out one of your resources, I was recommending it to people, is the Euthanasia Prevention Coalition. I get their emails.
Yeah, they're from Canada.
Everything they're doing.
No, a very, very big portion of these people are disabled.
Or what?
Disabled people, okay? People in wheelchairs, blind people, people with other medical problems, other with neurodegenerative diseases. They're under threat, and they know that they're under threat. I believe Alex Schottenberg.
AS.
Yeah, I think he has a medical condition.
But I mean, it's
very,
fabulous
very
if you
good.
can only get one, but,
Right.
No, yeah, definitely.
So I think I have.
Oh, I was
yeah.
gonna mention something about the.
Here's some
consumer-
information on the slippery slope anyway.
The consumer thing, the latest thing I saw is a company, you know, with their SEG score saying they
Yes.
will only allow people to buy 12 items a year from them because you're over-consuming.
Right.
So you can only buy 12 pieces of clothing.
Good.
And that shows you,
Well, I hope that they managed to go rapidly on business.
or they're charging you $200.
Yeah, that could be true. So in any case, this is a pretty good example of a slippery slope, starting from, okay, living wills. Oh, is there a living will? Yeah, let's see. Is your name Will? Are you alive? Yeah, okay, yeah, there's a living will. That person died. So that's just a comedic, I just saw this in Sunday's paper. I said, okay, that fits well enough. But that's an idea of a slippery slope type of argument. Yeah, Jeff?
That was an excellent review, and thank you, John, for
Thanks.
being a voice crying out in the desert. Sort of a comment answering Paul's question about where this is coming from. One of my last duties as president of Erie County Medical Society was to submit a resolution to the PA Medical Society to an annual meeting. And it was a resolution against physician-assisted suicide. And I thought it was a home run. But when I submitted it, I was surprised at how much opposition the resolution was. My resolution was very clear cut, passed just by 55, 56%.
Yeah.
And the opposition there, which is interesting, came from the younger physicians, residents, medical students, physicians in training, those kind of people. So it's not just the insurers, there's a cancer within that's furthering this.
And I think a lot of that, Jeff, is how young people are being taught. Okay? They're in these institutions of, no longer education, but indoctrination. They're all believing, or they're all being pounded with this claptrap. Okay? Radicalized autonomy, radicalized egalitarianism. It's not how well you do, but if you did well, it's because you're part of the patriarchy, or that you're white, or that you got it all, or you stole it from somebody else. All this other nonsense. It's radical progressivism, writ large. They're not taught how to think. They're not taught how to discern what proper truth is. They're not listening to any of this. They're not going to actually take an ethics course. They're not going to listen to anything and be able to make a logical argument about anything. They're taught to emote, and they're taught to regurgitate. And that's all they do. I don't know about you, but I had a lot higher respect for physicians before I became a physician. I think that a lot of physicians, and again, that's not taken away from you, Jeff, or many people that I know, but you go meet at the lunchroom, and most of the time they're talking about the sports page or something else. And it's not really, the highbrow, level of conversation that I was expecting. And physicians are not that different. They're highly skilled in their area. But unfortunately, unless you make a concerted effort to learn about these things, you're not going to learn. Certainly not in today's academy. You're certainly not going to learn. Look at what's happening in medical schools. They're using DEI, okay, to not only choose, but also be able to, choose people getting into medical school. I don't know about you, but I don't want my next cardiac surgeon to be the best left-handed circulation, okay? I want him to be the best surgeon, okay? I really, really, really don't care what his background is, where he came from, what disadvantages he had. I just want him to be the best, period. If that's a meritocracy, guilty as charged.
Okay, who's next? But now's our chance.
Go ahead.
Is there a list, or could we give you like our names if you know of any laws that are up to be voted on that we could contact our senators and congressmen?
There's nothing nationwide at this point that I'm aware of. But every year, somebody seems to sneak one in or tries to get it in, but it's always been defeated up to this point in Pennsylvania.
No, I mean like if you know of something, would
If
you
I
get
do.
in charge of, a hold of us? and
Well, you know what, if
we'll-
I learn of something, I'll let
Talk to
Tim know
Tim,
and he'll
yeah.
put it out.
Okay.
Okay, I guarantee you. Yes, ma'am.
I'll just add to that, the PA Pro-Life Federation website does